I'm glad to introduce Dr. Guadalupe Suchi Ayala, who is here to tell us about her career path for SSCP's How Did I Get Here video series. Dr. Ayala received her PhD in clinical psychology from the Joint Doctoral Program at San Diego State University and the University of California, San Diego in 2002, where she also earned her MPH in health promotion. She is currently professor in the Graduate School of Public Health at San Diego State University and co-director of the Institute for Behavioral and Community Health, a nonprofit research institute whose mission is to better understand Latino health disparities and ways to ameliorate them. Dr. Ayala is currently running multiple intervention and epidemiological research studies funded by agencies such as the National Cancer Institute, the Robert Wood Johnson's Foundation for Healthy Eating Research Program, and the Centers for Disease Control and Prevention. Her work examines a range of factors related to health and well-being in children, adults, and families, including improving access to and consumption of fruits and vegetables, promoting physical activity, and managing conditions such as diabetes, obesity, and asthma. Dr. Ayala, please describe your career path and tell us about any obstacles or barriers that you overcame along the way. In addition, tell us what has surprised you about your job and what you wish you had known earlier about this type of position.
Great, thank you very much. I'm honored to be part of this initiative. As the introduction said, my name is Guadalupe Suchi Ayala. I have a bachelor's degree in psychology and a master's degree in experimental psychology, followed by a PhD in clinical psychology, and then I got an MPH in health promotion. And I start with that really to give you a sense of my somewhat diverse path to becoming a public health professor. So I initially got interested in psychology, actually, after a hiatus from school. I originally started my undergraduate degree at University of California in San Diego, and I was a Spanish literature major. Very different from what I'm doing now. Part of this was influenced by my family. Both of my parents are professors, or they have PhDs. One in geography and human geography. My father likes to say that he likes to study people and the land. And my mom has a PhD in computer and library sciences. So as you can tell right off the bat, education is very important to my family. As a side note, both my brothers also have PhDs in education. So clearly it's a path that all of us assumed, but mine maybe took a little bit of a deviation along the way. So here's my first deviation. I started my undergraduate degree, as I said, at UCSD, University of California, San Diego, studying Spanish literature. In the middle of my second year, I decided I really didn't want to be in school. And really the only way for me not to be in school was actually to flunk out. So my first message is one can turn themselves around if one does not do well in the beginning. And for me, it was really the only way that I could sort of let my family know that I wasn't ready to start a college education, that I needed a bit more time to think about what I wanted to do. Unfortunately, having flunked out requires you to do a lot more backtracking in the process. But really that backtracking helped me to solidify what is it that I really wanted to do. So I left school, and then I spent about 8 or so years just working in a variety of different fields, hotel motel industry, the grocery store industry, and then eventually ended up working as the high school secretary of a small school district in California. And it was really through that process, through the mentorship from a variety of high school teachers, as well as a principal, as well as my family, that made me realize that maybe I needed to get back to school and fulfill some longer vision and not just think about a job going from sort of one job to the next. And so with the encouragement and support from the rest of my family and my friends, I returned to school, and that is when I discovered science. Really human science more than anything else. I had an amazing professor at the University of San Diego in a research methods class, actually, who just opened up a whole new world of inquiry to me. The types of questions she would ask. She's a cognitive psychologist. Her name is Dr. Annette Taylor. And she was doing some research on what we call lapses of attention and memory. So what does that mean? Do you ever find yourself driving along, thinking you're going to go one place and then find yourself going to a location that you go to every day? That's what a lapse of attention is. So the idea is that we're not always tuned into everything we should be doing, and we have these lapses of attention. She immediately got me involved in her research, which I was very grateful for, doing interviews, collecting data, entering data, and I was just like a puppy at the ocean, just really loving every single minute of it. Was able to then get involved in doing presentations and really learning how to then analyze the data that we had spent a lot of time collecting. So then I knew that I wanted to do science. I wanted to do some sort of science that involved human behavior, human beings, human thought. I was very fortunate. My last year of school, there was a professor, I'm not remembering her name, but she joined the faculty at University of San Diego and taught a class in health psychology. And it was really through that class, that I realized this is actually what I really want to do, sort of the intersection of people's behaviors, their cognitions, and the health consequences of those. So this teacher studied neuroimmunology, a really interesting science, but it wasn't necessarily what I wanted to do, but it really opened up another sort of set of methodologies that were really relevant to health. As a result of that class, I wrote, one of the products of that class was to write a review paper, or a research paper, and the topic I picked was the influence of roommates in a hospital on one's recovery. So we all know that if you've been in a hospital, you realize that sometimes you have to share a room with somebody. And the whole idea behind this research is what impact does it have on me to have a roommate who are either really coping very well from the either surgery or the health condition that brought them in, or is it better to have, so the idea, the theoretical basis for this was the whole idea of mastery versus coping. So the idea, is it better for me to have a roommate that was really doing well and, up on his or her feet and ready to get out that door? Or was it better to have somebody who was sort of modeling a coping strategies, not really doing so well, but sort of being able to figure out, problem solve some of the issues of recovering from whatever disease or injury you may have. So I wrote this paper for the class, did fine in the class, but more importantly, it made the professor realize that I was really interested in this topic. And it just so happens that there was a new MPH, or a new master's program at the California State University, San Marcos, in experimental psychology. And the woman who was actually doing research on roommates and the effects of roommates in hospitals was actually there. So I was just jumping for joy and thought, oh my goodness, the stars are aligned. There must be a reason for this. They have a new program. I'm interested in applying to a master's program, and the very person that I want to work with and study under is there and is interested in accepting students. So I put together what I thought was the best application possible. I had to go through a couple of hurdles because obviously having had failed my undergraduate degree is always a red flag to people, but I was successful in convincing them that that was the past me, this is the new me, and that I was really focused and wanted to be able to do something in this career. Thankfully, she took the risk with me and accepted me into the program, and that's really where I embarked on what I perceive now as my ultimate career, and that is really studying the intersection of health and human behavior, as then looking at a little bit more contextual issues, which is sort of where this started going with the hospital work. So Dr. Heike Mahler was my advisor in my master's degree, and she really taught me a lot about rigorous research methodology, really trying to make sure that you integrate theory into some of your work and the importance of theory. the importance of using various methodologies, different methodologies in combination to really answer a question without trying to remove some of the biases inherent in any sort of measurement approach. Started that program. It took me about 3 years to finish, in part because I did some independent research. So my research as a master's student in the program was to really look at what factors influence women's utilization of breast cancer screening services. How is it that the physician communication influences that interaction? What happens when a woman may get diagnosed with a lump? What is she going to do? And so forth. And so I did everything for that study. I went and recruited clinics on my own to be able to then recruit women, used a very systematic process for identifying the women. So unlike what maybe I would normally have done before my experimental degree, just go up to anybody who looks like they're friendly and maybe we're willing to answer, to doing it in a much more systematic way to try and reduce the bias associated with self-selection. And the other nice thing about that study was that I got information not only from self-report from the women to talk about their experiences, but also then really assessing their skills on how do they do a breast self-examination, what is involved in a mammography, and so on, to really get a good idea as to sort of what do they already know, so that if we wanted to do something differently to improve screening rates and to improve, obviously, what happens post-diagnosis if a woman is diagnosed. Trying to get all that information so that we can make some changes potentially in the clinic. It was that study, and it was thanks to the encouragement of my advisor, this was not her area at all, but she was willing to support me in this effort. And so that's another key message to everybody is don't let go of your passion. Sometimes there are people who will help you realize those maybe immediately or maybe in the future. But so don't ever let go of the things that you really want to study. So she supported me in this, and in the process of completing it, the master's degree, I realized that I really wanted to do a PhD. But interestingly, I wasn't sure what I wanted to do a PhD in. So I thought, well, on the one hand, I could apply for experimental psychology programs and sort of, but everybody I seem to encounter and ask, and I always ask people a lot of questions, everybody recommended that I might decide to do more of a clinical degree. Clinical psychology degree would allow me to then more easily, potentially, or as this was the idea, easily translate some of the things I'm learning in science into practice. So like I mentioned with the breast cancer screening, so here I did a nice scientific study, but then what was I going to do with that information? And my goal was really then to work with healthcare providers and clinic systems to be able to change what they do. At the same time, training women, doing education or whatever might be needed in order for them to have greater knowledge, greater understanding of what they're supposed to be doing, and then better skills to be able to detect their own lumps should they have any. So I decided to pursue the clinical psych degree, and I applied to a variety of programs. I was successful getting into several of them, but selected the joint doctoral program at San Diego State, University of California at San Diego. Most of my education has been in San Diego, and that's partly because it's just been convenient for me, partly, but also because the people I've wanted to study with have been here. So one doesn't have to move, but don't take that as a message that one shouldn't move, because that's also a good learning experience as well. So I was accepted into the program, and interestingly, I originally, when I submitted my application, just as any good graduate student does, I listed all the people who I wanted to work with and was very strategic about making sure that they do some similar stuff to what I want to do, or at least that I could communicate I wanted to do what they were doing, so that there would be a good match, because that's really important when you get to the doctoral program. And so I listed a variety of people that seemed like a good match. I was shortlisted on several of my applications to programs, which just means that you then go on to the next step. most clinical psych programs, doctoral programs, require that you do an interview. They want to make sure that you have the interpersonal skills to be able to work with patients. And so that's the main reason. Also because they are just so competitive. So they get hundreds of applications, and any of the top 100 people would be perfectly capable of being in the program. But what's the right combination of people for a particular cohort? Because it's also the people that you go to school with who often become lifelong friends, but they also help you in that process. So they want to make sure that there's a good match across the cohort members. So I applied, went for the interview, and interestingly, during my first interview, I was describing my interest, which I'll state more clearly in a moment, describing my interest to this faculty member, the person who I listed first as wanting to work with him. And he said, you really need to work with Dr. John Elder. And I said, oh, really? I said, I'm sorry, but I'm not sure I know who he is at the time. And so I felt a little sheepish, but I said, might as well know now. And he said, well, exactly what you're describing is exactly what he does. And I said, well, how do I meet this person? And is he accepting a student into the program? And he said, this other professor said, yes, he is accepting a student and he will be here this afternoon. So I said, do you have any idea what time he's going to be here? Because I'm going to stalk that door and look for him so that I may introduce myself and let him know that I'm really interested in his research. So that day, I finished the rest of my interviews, immediately went to an open computer, looked Dr. Elder up, and realized that this professor was exactly right on. We fit perfectly. Then I went to the door, and I really did stalk that door. Every time a gentleman came in that sort of looked like him, I asked whether it was Dr. Elder. And finally, he came in, and I immediately introduced myself. I had my packet in front of me, and I said, I understand you're taking a student. I'm sorry I didn't ask to meet with you. He is actually a professor in public health, so he was not necessarily on the list of people who I assume would be accepting students. That's why, obviously, I didn't list him. And he was very impressed by my being organized, my being ready, knowing a little bit of something about him. He said, well, I have one interview right now, but why don't you wait for me? I'll meet you in about a half an hour, 45 minutes. So I waited by the door until he was ready for me and opened the door, and we had the conversation that just changed my life completely. So Dr. Elder he actually has a degree in clinical psychology, so he was a good role model for me of somebody who also studied clinical psychology but was now working in public health. And it was during that initial conversation, even before I even started my PhD program, was even selected to be in the program, I realized that actually what I wanted to do was study the intersection of public health and psychology. And I was also very interested in working with somebody, and this is why Dr. Elder was so key in this, is that he studies Latino health and Latino health disparities. And I really wanted somebody who could help me learn the methodologies from the cultural perspective and also from the community perspective. And so fortunately, I beat out the other woman who was trying to get in to work with him, and he selected me to be in the program, and that's really how this last phase of my career was launched. So I started the clinical psych degree, was selected by Dr. Elder to work with him, so then started working with him at the Institute for Behavioral and Community Health Studies. And at the time, they were wrapping up tobacco-related research. But as a doctoral student, one of the nice things, and particularly in an environment as the Institute where I'm now back, they were very open. And so there was a doctoral student interested in studying something and, had the motivation to sort of help make it happen, i.e. help write grants, then we could go off into a new area, because I really did not have an interest in studying tobacco and alcohol. My interest was more around health, lifestyle behaviors like diet, physical activity, things were ultimately related to obesity. So I started working with him and developed a strong interest in diet. So that's sort of where most of my work is now. it was nice for me to be able to be in the clinical psych program because it gave me a lot of good training in assessment and counseling and working with families. Because there's a part of me, now that I'm in public health, there's a part of me that often wondered, should I have studied public health or psychology? And I'll get back to that point again in a moment. But I was ultimately glad that I did study clinical psychology because it gave me the opportunity to really work and understand people from their perspective in their lived environment, to really understand how is it that if I want to change something to make it healthier, what factors did I need to consider? So in my clinical degree, I really tried to focus on more family systems therapy. When I was doing my clinical residency at the University of Washington in Seattle, the School of Medicine, I specifically went there because they were testing some therapeutic modalities called multisystemic therapy. And the idea behind multisystemic therapy is that you're sort of working with the systems. These were kids who were in the juvenile justice system. So the idea was to work with the systems around these kids because it's the systems needed to improve in order for them not to get back in jail. And so working with the schools and realizing that if a kid misbehaves and you kick them out, you're actually reinforcing them for misbehaving. And so really understanding those concepts and how the system needs to change. I was very fortunate during the PhD in that there were some very innovative thinkers at the time, and among them John Elder, who said, as someone who had been trained in psychology, who was now working in public health, saying, there are some theories and methodologies that some students in clinical psychology could really benefit from. And so why not try and see, is there a way for PhD students in clinical psychology to do the MPH concurrently? So to get another master's degree in public health, specifically in health promotion and behavioral science, to get some of that additional program evaluation training, epidemiology training, and a variety of other things to sort of complement that. It was a lot of work, as you can imagine, 2 degree programs at once. But it actually opened up a whole new world for me because public health has a language all its own, and it allowed me to converse with people that I might not have been able to previously, or not as easily, would have taken a little bit longer. I think the other thing that I know it did is that when I went to then apply for jobs after my clinical residency at the University of Washington, I felt very comfortable applying for faculty positions in schools of public health because I could speak their language, I could bring in my clinical psych degree. So there was a nice complementarity to this, to those dual degrees. But interestingly, while I was doing both degrees, I was working in very large community-based trials, and these were trials, again, initially to prevent tobacco and alcohol consumption among youth, and then we moved into how to promote healthy eating. Among women. And then we went into working around childhood obesity and working with schools and restaurants and a variety of other people that have the option of touching kids' lives. In the process of sort of going big with some of my research studies, I started for my dissertation, realized, there's a lot of what we call noise in these studies, and how is it that I can be able to say, even though the designs might be randomized controlled trials that have sort of the inherent design that allows you to draw causal inferences, something that we often can't do in a lot of our research. There was also a lot of noise within those studies. So there's always things happening in the community environment that may be impacting both, say, the people in the intervention and, say, a control or a comparison group. So for my dissertation, I decided, I needed to do something that was my own, that was a little bit more controlled, that allowed me to say, if I do A, I'm going to get B. And so I did a very small experimental study, and it was just really teaching women, mostly women, there was a few men, how to estimate food portion sizes more accurately. And the idea behind that, again, was something that I could control, that I could do on my own, that was feasible for me to do with some student support. And I got a lot of master's and undergraduate students involved in my research. But it also, again, allowed me to draw that causal inference about this intervention and what it could cause. But it was also designed so that if eventually I wanted to put it into a larger study, say, and I eventually did into a family-based intervention, it would allow me to do that. So taking sort of this one evidence-based strategy and put it into a bigger project in order to have greater effects, greater changes. So as I mentioned, I finished my PhD, went and did my clinical residency at the University of Washington. Great experience there, wonderful clinicians. At the time, I was also selected to be part of a small group from among, I don't know how many interns we were, but from among the maybe 30, there was about 9 of us that were selected who were very research-oriented, knew that we all wanted to eventually go on to have faculty positions, because people who study clinical psychology, some people want to do more research and maybe more academic position, and some people really want to do clinical work. I knew that I never really wanted to do clinical work for a career, but I knew it was important for me to learn about it so that I could use it then in my intervention work. As a result of being selected for that research track, they paid for our travel if we wanted to go and visit other universities, supporting us in terms of helping us prepare our curriculum vitae so we could send it out for jobs. And so I was very fortunate the year that I was applying for jobs that there were a lot of positions open across the country. There were 2 things that people were really looking for, so it was perfect timing for me. One is that they were interested in people who were studying Latino health, because the Latino population was growing across the country because of the migration rates and because generally women younger, and so they're having kids. And also a real interest in people who were studying obesity and healthy eating and physical activity. So the obesity epidemic at that time, this was around 2002, was just skyrocketing. And so they said, we need to do something about this. Applied for a variety of positions, got a job at the University of North Carolina at Chapel Hill in the School of Public Health. And here again is where I think having even just had that master's degree, as hard as it was to try and do 2 degrees at once, I think was very instrumental in my getting that position, because I could, again, talk to people in public health, understood their language, understood their methodologies, but also could bring all the strengths that I had as a clinical psychologist to their work and to the students, to the classroom. I spent about 3 years there at the University of North Carolina. It was a great experience, but unfortunately, from a theoretical and a scientific perspective, wasn't as rewarding as I had anticipated it. And the reason why is because although UNC at Chapel Hill is an amazing research institute overall, and the School of Public Health is known worldwide, at the time, there were very few people who were studying Latino health. So whereas I was sort of talking about here, they were talking here. And I really needed people who understood, who were my equivalent to us to be able to move the field forward more quickly. Just too many issues that we needed to address. And I needed colleagues who were sort of with me, as opposed to my having to, say, educate all the time. It's fine be educating in the classroom, but when it came to the science, I really need that strong team. So after 3 years, I came back to San Diego. I'm happy to come back. I love it here. And there was actually a position open in the School of Public Health at San Diego State University. So everything, again, stars seemed to align. I was ready and prepared, and the stars aligned, and it allowed me to then come back. And I've been here ever since. I've been back since 2005 and started here as an assistant professor, and then quickly moved up the ranks to professor, which I am now. And teach in the Graduate School of Public Health, mostly doctoral students. I teach an advanced theory class, and I teach a grant writing class. I'm also co-director for the Institute for Behavioral and Community Health, and this is a a nonprofit research institute which really focuses on understanding and addressing Latino health and other health disparities. And really the work that we do is trying to improve systems, improve environments, improve organizations, families, and individuals, sort of to try and get the healthy behavior the easy choice, essentially, is the way we like to think about it. So 2 good examples of that are, I work with small grocery stores, we call them tiendas here in the Southwest, trying to get increased access to healthy foods in those stores, because we know if you walk into any of those stores, there's just a whole mass of unhealthy foods, but how is it that we can bring the healthy foods and price them at a amount that's reasonable for people so that they can choose that as opposed to an unhealthy snack. Another study that we're doing is working with restaurants, independent restaurants. Most independent restaurants don't have children's menus, and so we're working with these restaurants to say, let's see if we can create some healthy child menus, and let's see if we can then encourage families and kids to pick those healthy menus. And the idea is to try and create an environment that supports the healthy choice. So that's sort of my windy road to where I'm at. So again, starting in psychology with cognitive science and really going all the way to doing large community-based trials, working with clinics and restaurants and grocery stores. I honestly never would have imagined that I would be doing what I'm doing if I think back 20 years, but I'm really grateful. Obviously in this, I've had obstacles and challenges. Who doesn't have those, right? So really my obstacles are sometimes self-imposed. Sometimes we want more from ourselves than what we're able to accomplish. And so I think, if anything, I am my own worst enemy. And so if you're like that, just be careful with yourself and don't set up unreasonable expectations, because you're only as good as you are healthy. And so making sure you're eating right and exercising and getting enough sleep ultimately is going to do everybody good in the long run. Another obstacle I faced was, even though I came from a family, or maybe because I came from a family that was very well educated, there was always such a high expectation for that. And so I was constantly bumping up into, do I have to keep doing more? Once I finally embraced that this was also part of who I was, as opposed to battling against it, I fully embraced it, but it was also something that I realized I needed to do on my own and make my own way. And so that may be the same for you as well. But then the biggest obstacle just being the, having failed my undergraduate degree, because that stays on your record forever, and people always look at it. Now they don't, because I'm a full faculty member, but every step of the way, even when I was applying to clinical residency, and people always had that question. And so for me, it was making sure I practiced my response and said, this doesn't reflect who I am. It reflected the circumstances at the time. I didn't know what I was doing, and here's all the evidence of what I've been able to accomplish since then. So don't shy away from those things. Don't think that people are not going to see those negative aspects of your record, but explain them and just move forward and show them that this isn't who you are, but rather it was part of your past. And your past is an important part of who you are, so don't also deny it. What am I surprised about my job? I think I'm most surprised by I always thought when I was working with students that I would almost feel like I was becoming repetitive, that there was, sort of the same, on one level, there's sort of always very similar questions that students have. On the other hand, despite sort of the same things that people may face, it was always interesting to me how students really had sort of the latest and greatest things to think about. So maybe because of their own lived reality, and so the good example now is technology. I'm not really technology oriented. I mean, I got a smartphone and all that kind of stuff, but I maybe use 2 features on it. Whereas I have students who, use it, embrace it a lot more because it's been part of their lives in a much more fundamental way. And they can really think about ways that we can maybe use that technology for our intervention purposes. And so for me, what surprises me, and I maybe shouldn't be surprised by this, but just how much new innovation students bring to the classroom, to our conversations, to our research team meetings. And it's constant, and it's sort of like, wow, this is really exciting, but also a bit surprising that there would be so much new innovation coming from students who may not have a background, but they have enough of an understanding to see how things sort of fit together. I guess to conclude, if there was something I wish I would have known before, actually, no, because I think that I am who I am because of the experiences that I've had, and I wouldn't really change any of that. I appreciate who I am, and I know that through the bad times and the good times, it has sort of made me realize who I am, and I really appreciate that, and hopefully my students appreciate that, my staff appreciate that. So there's really nothing I would change. I just continue to share what I've been through and what I've learned with other people to maybe help you avoid some of those obstacles, but they're also okay to experience. So I wish you luck in your any next decision that you might be making. Thank you very much.
Thank you very much, Dr. Ayala.
Excellent.